Hi, I'm Dr. James Amos, consulting psychiatrist at the University of Iowa Hospitals and Clinics in Iowa City, Iowa. And I have an announcement to make about the second annual American Delirium Conference in Indianapolis, Indiana. It'll be held on June 3rd to June 5th, 2012 at the Omni Severn Hotel on 40 West Jackson Place. And you can find out more details about the conference at americandeliriumsociety.org, or you can find it on my blog site at The Practical Psychosomaticist at jajsamos.wordpress.com. The second annual meeting, as I said, will be held in Indianapolis, Indiana on June 3rd through June 5th, and it's sponsored by the American Delirium Society. The goals of the American Delirium Society are to improve recognition, treatment, and prevention of delirium among patients everywhere within the healthcare system. And the annual meeting is an important vehicle for disseminating current research about the epidemiology, pathophysiology, and prevention and treatment of delirium to healthcare professionals from around the world, from multiple disciplines and backgrounds. The two main goals of this year's conference will be to disseminate knowledge on the state-of-the-art in delirium identification, treatment, and prevention, and secondly, to discuss new directions for delirium identification, prevention, and treatment strategies. This is a conference that you won't want to miss because Dr. Sharon Inouye and Dr. Ann Kolanowski will be keynote speakers, and they'll be discussing current knowledge and innovations in delirium treatment and prevention from the perspective of both medicine and nursing. Sessions will include the following. Pathophysiology of delirium. We'll examine the work that's being done on biomarkers for delirium diagnosis, prognosis, and therapy response. Measurement of delirium, and this will be very interesting. We'll focus on the cutting-edge research in delirium identification tools. Post-operative delirium will review issues that are pertaining to the brain undergoing the stress of surgery and about current research strategies regarding detection and treatment of delirium post-operatively. The long-term outcomes of delirium will present current knowledge regarding the impact of delirium on subsequent mood, cognition, morbidity, and mortality. Delirium care in the 21st century will center on new prevention, evaluation, and treatment techniques. And finally, clinical trial updates will highlight new and ongoing treatment trials with regard to delirium and delirium prevention. It's hoped that the second annual meeting of the American Delirium Society will facilitate advancement for new and improved strategies for the care of many patients who are at risk for delirium throughout our healthcare system. Well, I hope you'll join me because I plan to attend. I have cross coverage for the consultation service during those dates. Thanks very much for listening. Hope to see you in Indianapolis for the American Delirium Society second annual conference in June.